Hello and welcome to Pregnancy Info. Today we're going to discuss that when can you have sex after delivery? Complete guide after normal and C-section birth. If you are a new mom or a couple navigating an beautiful yet challenging postpartum journey, this video is for you. One of the most commonly asked yet least openly discussed questions after childbirth is when can we have sex again after delivery? Whether you have had a normal vaginal birth or a C-section. Today, we are diving deep into this topic not just from a medical angle but emotionally and mentally too. We will also talk about what changes happen in the body, how long it takes to feel normal again, and how to gently reconnect with your partner after this life-changing experience. Grab a cup of tea, sit back, and let's have this much-needed conversation. Let's start with the basics. What do doctors say? Doctors usually recommend waiting at least 6 weeks before having sex after childbirth. But why exactly 6 weeks? Here's what happens during this time. Your uterus is still shrinking back to its normal size. You might still be experiencing nausea, the post-delivery bleeding that can last 4 to 6 weeks. If you have stitches either due to a tear or episiotomy, they need time to heal properly, and most importantly, your body is vulnerable to infection during this phase. So 6 weeks isn't a magic number but a general guideline for some women. It might take longer, and that's completely okay. What if you had a C-section? Many think that C-section recovery is easier in terms of intimacy since there is no vaginal tearing, but that's a myth. C-section is a major abdominal surgery. You have got stitches inside and out, and your body needs time to heal from that trauma. You will still experience postpartum bleeding and discomfort. Abdominal pain, backache, and soreness from the incision can make movement, including sex, uncomfortably. So, even after a C-section, the 6 weeks rule generally applies, but listen to your body. Some women may heal at 8 weeks, others not until 3 months. What changes happen in the body postpartum? Let's talk honestly about that many women experience but rarely say out loud. The vagina might feel looser, drier, or even sore for weeks. Hormones take a nosedive after birth, especially estrogen, which can lead to vaginal dryness, especially if you are breastfeeding. Your pelvic floor muscles are weaker, which can affect sensation and comfort. You might experience urinary leaks, gas, or bloating after intercourse. These are normal and temporary but can feel scary or frustrating. The key is to be patient and kind to yourself. Emotionally, it's a roller coaster. Postpartum is not just about healing the body, it's also about emotional recovery. You might be feeling exhausted from sleepless nights, disconnected from your body, anxious or teary thanks to hormonal shift, or even like you are not ready to be touched at all. And that's okay. There is no rush to be intimate. Your body just gave birth to a human. It's perfectly valid to need time. Also, many women struggle with body image after delivery, stretch marks, weight gain, scars. They can make you feel self-conscious. But please now, your body is not ruined. It's just changed, and that powerful. What about the partner? Partners go through changes too. They might feel unsure about initiating intimacy. Some feel nervous about hurting you or are dealing with emotional shift of their own. So, what's the solution? Open communication. Talk about how you are feeling. Set boundaries if needed. Express your needs without guilt. Remember, intimacy isn't just physical. It's also about connection, touch, and trust. Even small gestures like cuddling, forehead kissing, or holding hands can be incredibly healing. Tips for resuming. Once you do feel ready, here are some tips to make things smoother and more comfortable. Use a good lubricant. Start slow. Choose position that put less pressure on your belly or pelvic area. Communicate during. If it hurts, stop, it's okay. Try pelvic floor exercises to rebuild strength and sensation. Don't forget to check with your doctor before resuming sex. And most importantly, don't pressure yourself to be back to normal. Intimacy isn't a performance, it is a shared experience that should feel safe and mutual. But how long until you feel normal again? Some women feel emotionally and physically ready in 6 weeks. Others take 3 months, 6 months, or even a year to feel truly back to themselves. Recovery isn't just physical, it's also mental and emotional. And honestly, you may not return to your old normal. You might find a new version of yourself, and that's beautiful too. When to talk a doctor? See your doctor if you experience pain during sex that doesn't go away, bleeding after intercourse, severe vaginal dryness, fear or anxiety that's interfering with your well-being. Sometimes a little medical support, physical therapy, or counseling can make a huge difference. In the end, postpartum recovery is not a race. Whether you are healing from a normal delivery or a C-section, your body deserves time, care, and gentleness. There is no right time to have sex again. It's when you feel ready. And remember, intimacy is not just about sex, it's about connection, trust, and mutual care. If this video helped you or someone you know, please give it a thumb up, subscribe, and share it with anyone on this journey. You are not alone. You are healing and you are doing an amazing job. See you in the next video.